Gentlemen, I'm Dr. Shalene Jomas, and I've spent over 25 years as a urologist helping men over 60 rediscover passion, confidence, and deep intimacy with their wives. If you've noticed that your stamina in the bedroom isn't what it used to be, if you're finishing faster than you'd like, and seeing disappointment or understanding in her eyes that breaks your heart, if you've tried pills or supplements that gave you temporary hardness but did nothing for how long you actually last, then what I'm about to share with you today could change everything starting tonight. I recently had a patient, let's call him Robert, age 67, come into my office with tears in his eyes. He told me, "Doc, I love my wife more than anything. We've been married 42 years, but lately things are over before they even begin. She says it's fine, but I can see it in her face. I feel like I'm failing her." Robert's story isn't unique. In fact, studies show that over 70% of men over 60 experience premature completion or reduced stamina, and it's quietly destroying the intimacy in millions of marriages. But here's what gives me hope every single day. It doesn't have to be this way. You can bring back the fire, the connection, the ability to truly satisfy her again, naturally, safely, and starting as soon as tonight, using an ancient breathing routine that rewires your body's natural control systems. The problem: understanding what's really happening in your body. Let me be completely honest with you, gentlemen. As we age past 60, our bodies go through very real, very natural changes that directly affect our performance in the bedroom. This isn't weakness. This isn't failure. This is biology, and once you understand what's happening, you can work with your body instead of against it. First, the pelvic floor muscles, the same muscles that control your bladder and your ejaculatory reflex, naturally weaken with age. Think of these muscles as a dam holding back a reservoir. When they're strong in your 20s and 30s, you have complete control over when to release. But after decades of sitting, decreased testosterone, reduced physical activity, and simple aging, that dam develops cracks. The result? You reach the point of no return much faster than you want to, sometimes within just 2 or 3 minutes, when you'd prefer to last 20 or 30. Second, the neural pathways between your brain and your pelvic region become less sensitive to your conscious control. In your younger years, you could mentally pull back when you felt yourself getting too close. But now, that mind-body connection has weakened. Your brain sends the signal to slow down, but your body doesn't respond quickly enough. It's like trying to brake a car with worn-out brake pads. There's a dangerous delay. Third, blood flow patterns change. Yes, blood flow affects erections, but it also affects stamina. When oxygenated blood isn't circulating optimally through your pelvic region, the muscles fatigue faster and lose their ability to maintain tension and control. You become more sensitive, more reactive, and less able to pace yourself. And finally, there's the emotional component that nobody talks about. I've had thousands of men sit across from me in this very office and confess their deepest fears. What if she finds someone else? What if she's just pretending to be satisfied? What if I'm not a real man anymore? This performance anxiety creates a vicious cycle. You're so worried about finishing too fast that your body floods with stress hormones, which actually makes you finish even faster. One patient, James, told me he'd been avoiding intimacy with his wife for 7 months because the shame was unbearable. She thought he didn't find her attractive anymore. Their marriage was crumbling, not because the love was gone, but because he couldn't last more than 90 seconds. The emotional toll of premature completion isn't just about the minutes lost in bed. It's about the connection, the confidence, the feeling that you can still be the man she fell in love with. Why pills and quick fixes fail you? Now, I know many of you have tried the conventional solutions. You've taken the little blue pill, the supplements from the gas station, the herbs your friend recommended, and maybe they helped with firmness. Maybe they helped you get ready for round 2. But did they help you actually last longer? Did they give you real control? For most men, the honest answer is no. Let me explain why. Medications like Viagra, Cialis, and Levitra work by increasing blood flow to create and maintain an erection. They're vasodilators. They open up blood vessels. And for men with erectile dysfunction, they can be genuinely helpful. But here's the critical point. They do absolutely nothing for ejaculatory control. They don't strengthen your pelvic floor. They don't retrain your neural pathways. They don't address the root cause of why you're finishing too quickly. Think of it this way. If you have a leaky faucet, putting a bigger bucket underneath doesn't fix the leak. Viagra gives you a bigger bucket, but the leak, your lack of stamina, remains unchanged. You might be harder, but you're still finishing in 3 minutes, and now you're paying $50 a pill for the privilege of that disappointment. Over-the-counter supplements are even more problematic. Most are completely unregulated, filled with questionable ingredients, and backed by zero legitimate research. I've seen patients spend hundreds of dollars on horny goat weed, maca root, and proprietary blends that promise stamina, but deliver nothing but placebo effects and potential liver damage. And even if some ingredients have mild effects, they're still just treating symptoms, not causes. Then there's the side effect issue. Headaches, flushing, indigestion, vision changes, dangerous interactions with heart medications. These are real risks. I've had patients end up in the emergency room because they mix these pills with their blood pressure medication. Is a few extra minutes of hardness worth a heart attack? Of course not. The fundamental flaw with all these quick fixes is that they're external solutions to an internal problem. Your body has lost its natural ability to control arousal and delay climax. No pill can restore that ability. Only retraining your body's own systems can create lasting, real change. The big reveal. The ancient breathing routine that changes everything. So what's the answer? What actually works? Gentlemen, I'm about to share with you something that transformed Robert's marriage, that brought tears of joy to James's eyes when he told me about his first successful night, that has helped over 2,000 of my patients naturally extend their stamina from 3 minutes to 30 minutes or more. It's called parasympathetic arousal control breathing, and while the name might sound complex, the technique itself is beautifully simple. It's based on ancient Taoist practices that men in China use for thousands of years to cultivate sexual energy and stamina, combined with modern research on the autonomic nervous system. And you can learn it in the next 5 minutes and apply it tonight. Here's the overview before we dive deep into the science and exact technique. This breathing routine works by activating your parasympathetic nervous system, your body's rest and digest mode, while simultaneously strengthening your conscious control over your pelvic floor muscles. When you're aroused, your body naturally shifts into sympathetic mode. Heart rate increases, breathing becomes shallow, muscles tense, and you race toward climax. This breathing technique interrupts that pattern, keeps you in a state of relaxed arousal, and gives you the mental and physical control to last as long as you choose. The routine has 3 components. First, a specific 4 to 7, 8 breathing pattern that you use during intimacy. Second, a pelvic floor engagement technique synchronized with your breath. And third, a mental focus strategy that redirects arousal energy throughout your entire body instead of concentrating it in your genitals. Master these 3 elements, and you'll have more control than you've had in decades. The science. Why this works when nothing else does. Let me take a moment to explain exactly why this ancient breathing routine is so powerful, because when you understand the science, you'll approach the technique with confidence and commitment. Your autonomic nervous system has 2 branches, sympathetic and parasympathetic. The sympathetic branch is your fight or flight system. When it's activated, your body prepares for quick action. Heart pounds, adrenaline surges, and yes, ejaculation happens rapidly. This was useful when humans needed to reproduce quickly in dangerous environments, but it's not useful when you want to enjoy extended intimacy with your wife in the safety of your bedroom. The parasympathetic branch is your rest and digest system. When it's activated, heart rate slows, muscles relax, and crucially, your ejaculatory reflex becomes much less reactive. You stay aroused, but in a calm, controlled way. The problem is that most men over 60 have lost the ability to consciously shift between these two states during intimacy. The excitement immediately triggers sympathetic dominance, and the race to climax begins whether you want it to or not. This is where the 4 to 7 to 8 breathing pattern becomes revolutionary. When you inhale for 4 counts, hold for 7 counts, and exhale for 8 counts, you're sending a direct signal to your vagus nerve, the main nerve of your parasympathetic system. This isn't mystical, it's measurable physiology. Studies have shown that extended exhalation immediately lowers heart rate and activates parasympathetic tone. You're essentially telling your body, we're safe, we're not in danger, there's no rush. Now combine this with pelvic floor engagement. Your pelvic floor muscles, specifically the pubococcygeus muscle, or PC muscle, directly control the ejaculatory reflex. When this muscle is weak or when you've lost conscious control over it, you can't stop ejaculation once it starts. But when you squeeze this muscle rhythmically during your exhale phase, you're doing 2 things. First, you're physically interrupting the ejaculatory reflex, like applying the brakes. Second, you're retraining the neural pathways between your brain and your pelvic floor, rebuilding that mind-body connection you've lost. Think of it like this. Imagine you're training a muscle you didn't know you had. Every time you consciously squeeze and release your PC muscle while breathing correctly, you're making that muscle stronger and making the neural connection faster and more reliable. Within just a few days, you'll start to feel the difference. Within 2 weeks, you'll have conscious control that rivals what you had in your 40s. There's also a hormonal component that's absolutely fascinating. When you practice this breathing technique during intimacy, you're modulating the release of dopamine and norepinephrine, the chemicals that create the sensation of urgency and the drive toward climax. Instead of a sudden dopamine spike that pushes you over the edge, you create a steady, sustained elevation that keeps you aroused but in control. Meanwhile, the parasympathetic activation increases oxytocin, the bonding hormone, which actually enhances emotional connection with your wife and makes the entire experience more meaningful. One of my patients, Michael, 71 years old, described it beautifully. "Doc, it felt like my body remembered something it had forgotten, like I'd been trying to drive a car with a broken transmission, and suddenly all the gears worked again. I could feel myself getting close. I'd do the breathing, and I could actually pull back from the edge. For the first time in maybe 20 years, I was in the driver's seat." The mental redirection component is equally important. Most men over 60 have decades of conditioning to focus all their attention on genital sensation during sex. This creates a feedback loop. The more you focus on how good it feels, the faster you get to climax. The ancient Taoists understood that sexual energy, or Jing, needed to be circulated throughout the body, not concentrated in one area. Modern neuroscience backs this up. Attention literally increases neural activity and sensitivity in whatever body part you focus on. By consciously redirecting your awareness during intimacy, feeling the breath in your lungs, the connection with your wife's skin, the strength in your core, you distribute arousal throughout your entire body. This doesn't decrease pleasure. It actually increases full-body pleasure while decreasing the rush toward climax. You become a man who can enjoy every moment, every sensation, instead of a man racing toward a finish line. Step by step. The exact technique you'll use tonight. All right, gentlemen, let's get practical. I'm going to walk you through the exact technique step by step. I encourage you to practice this a few times before you use it during intimacy, so it feels. Step 1. The 4-7-8 breath. When you feel yourself approaching about 70% of your arousal limit, that point where you know you're getting close, immediately begin the 4-7-8 breath. Inhale slowly and deeply through your nose for a count of 4 seconds. Feel your belly expand, not just your chest. Hold that breath for 7 seconds. Then exhale slowly and completely through your mouth for 8 seconds, making a gentle whooshing sound if that helps you maintain the count. Step 2. PC muscle engagement. Here's the critical part. During the 7-second hold and the 8-second exhale, squeeze your PC muscle firmly. This is the same muscle you'd use to stop urinating midstream. Squeeze it firmly, not so hard that you're straining, but firmly enough that you really feel it. Hold that squeeze through the hold and the exhale, then release completely during the next inhale. Step 3. Mental redirection. As you perform this breathing and squeezing, mentally scan your body from head to toe. Feel the air in your lungs. Notice the strength in your arms. Connect with the sensation of your wife's body against yours, but not just genitally. Feel her warmth, her breath, the emotional connection. Imagine your arousal as a warm energy that's flowing from your pelvis, up your spine, and throughout your whole body. Practice protocol. Before you use this during intimacy, practice it 3 times a day for 3 days. Sit quietly. Imagine yourself in an intimate situation and run through the complete cycle 5 times in a row. This trains your body so that when you're actually in the moment, the technique feels automatic and natural, not awkward or mechanical. Common mistakes to avoid. First, don't wait until you're at 95% arousal to start. That's too late. Start this technique when you're around 70%, still very much enjoying yourself, but before the point of no return is imminent. Second, don't hold your entire body rigid. Keep your breathing muscles engaged, but let the rest of your body stay relaxed. Tension accelerates climax. Relaxation extends it. Third, don't stop connecting with your wife. Maintain eye contact. Continue gentle movements. Keep kissing and touching. This isn't a timeout. It's a technique you integrate seamlessly into your lovemaking. Results and timeline. What to expect now? Let's talk about what you can realistically expect, because I want you to approach this with both excitement and patience. On your very first night using this technique, you should notice improved control. You might not last 30 minutes right away, but if you've been lasting 3 minutes, you'll likely extend to 7 or 10. More importantly, you'll feel the control. That sensation of, I can actually manage this instead of, I'm helpless. That psychological shift alone will transform your confidence. By the end of the first week, with daily practice and ideally 2 to 3 intimacy sessions where you apply the technique, most of my patients report lasting 15 to 20 minutes comfortably. The PC muscle is already stronger, the neural pathways are reconnecting, and the breathing has become more automatic. One patient, Thomas, age 68, came back after 10 days and told me his wife actually initiated a conversation about what had changed. She said she could feel that he was more present, more in control, and more focused on their mutual pleasure rather than racing to finish. "Doc," he told me. She thanked me. After 37 years of marriage, she thanked me for caring enough to work on this. By the 1-month mark, you should be able to last 30 minutes or more if you choose to. And here's the beautiful thing. You'll reach a point where you can decide when to finish. You'll have that much control. You'll be able to say, I could keep going, but we're both satisfied, so let's finish together now. That's the goal, not to become a marathon man, but to become a man with choices. Your wife will notice the difference in multiple ways. First, obviously, the extended duration gives her body more time to build arousal and reach climax, something that becomes harder for women over 60 as well. So this mutual pacing benefits both of you. Second, she'll sense your confidence. Women are incredibly perceptive, and when you're not anxious or rushing, when you're present and enjoying her, that confidence is attractive and deeply connecting. Third, the emotional intimacy deepens because you're not ending the experience in frustration or embarrassment. Bonus tips and warnings for maximum success. Let me give you a few additional strategies that will amplify your results with this breathing technique. Bonus tip 1, the morning PC muscle workout. Every morning while you're still lying in bed, do 50 PC muscle squeezes. Squeeze for 5 seconds, release for 5 seconds, repeat. This takes about 10 minutes and dramatically accelerates the strengthening process. Within 2 weeks, you'll have a PC muscle that responds instantly to your mental commands. Bonus tip 2, the pause and connect technique. During intimacy, every 5 to 7 minutes, pause all movement for 20 to 30 seconds. Stay connected with your wife, maintain eye contact, whisper something loving, but cease all thrusting or friction. This gives your arousal level a chance to drop from 90% back to 70%, and you can then continue. This pause isn't awkward, it's intimate, and most wives find it incredibly romantic and attentive. Bonus tip 3. Hydration and circulation. Drink at least 64 ounces of water daily. Proper hydration improves blood flow and makes the PC muscle more responsive. Additionally, 15 minutes of walking each day increases pelvic circulation and supports the entire system you're training. Important warnings. First, if you have a history of heart problems, check with your physician before implementing any changes to your intimacy routine. While this breathing technique is generally safe, your doctor should know what you're doing. Second, avoid alcohol before intimacy. Alcohol numbs sensation, which might sound helpful, but it actually interferes with your conscious control and the mind-body connection you're building. Third, never strain or force the PC muscle squeeze. If you feel sharp pain, stop immediately. The squeeze should feel like a firm, controlled contraction, not a painful strain. Conclusion. Tonight, you can be the man she remembers. Gentlemen, as I look at you through this camera, I want you to know something. You are not broken. You are not too old. You have not lost your manhood. What you're experiencing is natural, but it's not permanent, and it's not inevitable. This ancient breathing routine, this parasympathetic arousal control breathing technique, has transformed thousands of marriages. Men who thought their intimate life was over have rediscovered passion, connection, and the joy of satisfying their wives completely. The breathing pattern calms your nervous system. The PC muscle engagement gives you physical control. The mental redirection distributes your arousal. Together, these 3 elements make you a man who lasts as long as you choose. Robert, the man I mentioned at the beginning, came back to me after 3 weeks and showed me a handwritten note from his wife. It said, "Thank you for falling in love with me all over again." He hadn't told her he was working on this with me. She just felt the difference. The confidence, the control, the presence, the passion. You can have that same transformation. Starting tonight, you can walk into your bedroom with confidence instead of anxiety. You can enjoy every moment of intimacy instead of dreading how quickly it will end. You can see satisfaction and joy in your wife's eyes instead of polite understanding. All it takes is commitment to this simple technique. Practice the breathing for 3 days before using it. Use it consistently during intimacy. Strengthen your PC muscle daily. Within 1 week, you'll feel the change. Within 1 month, you'll wonder why nobody taught you this 40 years ago. Gentlemen, if you found this information valuable, please click the like button below. It helps other men over 60 discover this life-changing routine. Subscribe to my channel for more discreet, effective men's health advice that actually works. And leave a comment saying, "I'm trying this for her." Let me know you're committed to transforming your marriage naturally.